Hello, everyone. Thank you for being here this evening. My name is Mike Scott. I'm the superintendent for the Hillsboro School District, and I wanted to let you know what our format's going to be this evening. First of all, I'm going to start with some short opening comments. Following that, we'll have some comments from Washington County Public Health, and then we'll have an opportunity to engage in some brief question and answer period. With us this evening, we've got some board members with us this evening. We've got Jackie Spross and Martin Granum. We've got members of Washington County Public Health, and we've got district administrators who are assisting us in our response. As you're aware, we've had a student at South Meadows Middle School who tested positive for COVID-19. Our first concern, of course, is for that student. We look forward to welcoming that student back to school when they are symptom-free and ready to come back. So our thoughts are with that student. I'd also like to take an opportunity to thank Oregon Department of Education, Washington County Public Health, Oregon Health Authority for their continued partnership and guidance. They continue to consult with us on an ongoing basis, and their guidance for the Hillsboro School District has been greatly appreciated. Additionally, we've had the City of Hillsboro leadership reach out to us and offer any assistance and support that they could provide if it becomes necessary. Because our number one concern is for the health and safety of our students and our staff, we've worked closely with our partners and to determine our response to our student who's tested positive for the virus. And based on the advice of the health professionals, we will not be closing the school. This is based on clear guidance that is being provided by the health professionals that I've mentioned before. Of course, any other individuals that are determined to be at an enhanced risk of exposure will be contacted by Washington County Public Health, and they will be contacted by the Washington County of Health. That will not be a district contact. I also want to let you know that over the past week, we've modified our cleaning procedures, and we've focused on those high-touch areas that oftentimes would occur within a school. In addition to that, we are cleaning our buses each day to make sure that they're being disinfected, and those protocols have been in place for the last week. In addition to that, just as an abundance of caution, we've arranged for South Meadows Middle School to be cleaned again prior to the opening of school tomorrow. We've hired a contractor to do that work, and that'll be taking place throughout this evening. We've continued to provide information to our students, and we understand that the best prevention is education. We have encouraged them and reviewed the proper procedures and good health hygiene habits, everything from washing hands, covering coughs and sneezes, getting plenty of rest, etc., and we continue to make that information available to our students and to review that with them. Please know that our students are our number one priority, and we're doing everything we can to keep each of our students and our staff members healthy and safe. At this point, I'd like to turn it over to Dr. Christina Baumann, who is the Washington County Health Officer. Christine.
Thank you so much. Thank you, everyone, for being here today. Today, we share in the concern of our community members about this news about a student who has tested positive. What we know is that this individual did attend school for one day while they had very mild symptoms, and then self-isolated at home and has tested positive for COVID-19. This raises the uncomfortable reality that we're facing nowadays. As you have seen in the news, there have been several new cases across Oregon that have not been related to travel and are thought to be community acquired. We now know that at some level we have COVID-19 in Oregon, and we may see more cases. As a result of this, there has been a lot of attention to guidance for schools, and the Oregon Health Authority, public health officials, and the Oregon Department of Education have developed guidances for schools. Every situation is different, and in this situation, what we are recommending with the Oregon Health Authority and Oregon Department of Education is that the school not close. We know that there is COVID-19 across the state and in our community, and rather than close the school, we want to take this opportunity to notify you about this and to heighten your awareness about precautions that everyone can take to decrease the chances that they get sick or that they spread the illness. We have seen that children tend to have milder illness and are less likely to have severe illness. We want to support the school in their efforts to keep kids healthy. And as such, the primary message that we want to get across to our school community and to our community more broadly is if you have any symptoms of infectious illness, do not go to school. This has always been true for any infection, whether it's something as serious as influenza, COVID-19, or other infections. Infections spread when sick people mix with well people, and everyone can do their part to limit the impact of COVID-19 on our communities and our schools. Other things that people can do have been touched on again and again, and I have to say this with all seriousness. These are really important things that we hope people pay close attention to and take the precautions to do. Stay home when you're sick. Wash your hands frequently with soap and water. Cover coughs and sneezes. Avoid touching your eyes, nose, and mouth. And avoid contact with people who appear sick. So with those words, I want to open it up for questions for either Mike Scott or myself.
Can you explain why you don't recommend closing the schools at this point?
Well, I can tell you that we're following the guidance of Oregon Health Authority and Washington County Health, and my understanding is that the virus does not spread through that casual contact, and I should let the doctor expand on that more.
So we know that COVID-19 is a respiratory illness and spreads through droplets, and the people that are at highest risk are those that are in close contact for prolonged periods of time. Every situation is different, and in looking at this particular situation, we do not believe that closing the school would affect the community spread at this time. We know that there is illness in the community, and it can continue to be introduced in different ways. So right now, rather than close the school, we are emphasizing the importance of not attending school, going to work, or public gatherings if you have any symptoms of illness.
Can you talk more about your plan for trying to now kind of backtrack and see who this person has been in contact with, and then how widespread that will be, or what that will look like? Could this be other students who are in the classroom specifically, or can you just elaborate on that?
Mm-hmm. So in general, with public health investigations with infections like this, and especially when those at highest risk are those that have close, prolonged contact, we follow up with those individuals and notify them. In the terms of this school, it can be very hard to do that. Schools, students especially, mix quite a bit during the school day, can have interactions in multiple different environments, and so it cannot necessarily always be a great a method for an environment like that, as it can be in other situations where you can clearly identify places and persons that may have had more extensive exposure. So our recommendation to our school community, because of that, is to do a general notification. And the opportunity here is that everyone should be vigilant for signs and symptoms of illness, and to stay home at the first sign of illness, and to not return to activities until any symptoms have resolved for at least 72 hours.
How is this different than like Oswego? Because they shut their school down for another week, for like the 2-week period after the last exposure was for their person.
Mm-hmm. So I can't speak to the decisions made by other school districts, other schools, and in other counties. What I can say is that as we move forward, every situation will have to be looked at independently, and a decision made that's right for the situation and for the school community.
Is anyone else being tested right now or monitored closely?
So I can't go into details about a public health investigation. What I can say is that we have had cases in Washington County, and we have had cases across Oregon, and the public health follow-up is to contact persons who have had close contact, and in some cases to provide health education and help monitor for any symptoms in order to help people seek care if they need it.
Earlier at the press conference this morning, you said 4 out of the 5 cases were connected to the first case that we saw, and that was the employee from the Lake Oswego. So do you know, is it more people from who work at that school, or can you elaborate any more on those 4 cases
I'm sorry, I can't go into a lot of details about the public health investigation or details on this individual. You're right, this morning I did say that we had 5 new diagnoses of this illness in Washington County. 4 of those were identified through a public health investigation, and one of those cases is unrelated at this time that we know to prior cases and is unrelated to travel.
This might, okay, this might be more for the superintendent, but we had a lot of worried parents sounding off to us, just in the time that this has been announced, and what do they can they voluntarily pull their kids out of school? Is that an option?
Well, we encourage our students to come to school because we believe that every day matters. Of course, parents will make their own decisions about whether they send their kids to school or not. I would just reiterate that our students are not a high-risk population, and the advice that we've been given is that it is a safe environment for students to gather. So we will continue to have those conversations with our parents and help put their mind at ease with the information that we have available.
Even if they're not high risk, can they, for developing dangerous symptoms, can they acquire the virus and spread it in the community?
I'll let you answer that.
So the question is, can students acquire the virus and spread it in the community? This virus anyone can get this virus. So and we know that we have had instances of community spread. So the message is the same for everyone in Oregon today.
Let's say a student has a grandparent or grandmother at home. You take that home. You do not suggest that a student who has some family members in that group that's dying from this still come to school? What advice would you give somebody who has a part of the population is very bad when you get this? What would you advise a student who is in contact with that population of older adults?
Mm-hmm. That's a really good question and highlights a really important point that we will try to emphasize again and again. So what we know is the population that is at highest risk for severe illness is people over the age of 60 and absolutely people who have chronic medical illnesses. These are individuals who should take additional precautions, especially in the situation that we face now with some instances of community spread. And those precautions should be to avoid contact with anyone who's ill and to consult with their healthcare provider and to minimize potential exposures to illness such as in public gatherings. We are also trying to message out to the community to decrease the chances that illnesses could be introduced to some of these populations. So an important thing that people can do to protect our grandparents and those in the population that are over the age of 60 include, if you have any illness symptoms, please do not visit long-term care facilities or hospitals while you are ill. That is one way that infections do get introduced into those environments, and there are many vulnerable people in those environments.
Is this case with a student having it, a middle school student, is that unique at all? Because I feel like a lot of what we are hearing are the older adults and those in the high risk population.
So as we mentioned, anyone can get this virus. What we have seen is that children tend to have milder symptoms, so they may not need medical attention when they have an infection with COVID-19. The more severe illnesses have been in those that are older, and when they have severe illness, they will present for medical attention, and that could be one of the reasons why that age group has had more illnesses identified.
What's your response to parents who are now, concerned and want to get their children tested?
Mm-hmm.
What do you suggest?
Yeah, so that's a really important point. In addition to not introducing infections into places like long-term care facilities, healthcare facilities too are a place where we need to be cautious. And what our advice to the general public is is if you would not otherwise seek medical care for the symptoms that you have, we urge you to stay at home and recover at home. Testing, there will not necessarily change the outcome. There is no specific treatment for COVID-19 right now. And we look forward to, in the future, having more testing available. Right now, the testing is being prioritized to those who are severely ill and those who the information may change their treatment course.
Can we talk about the timeline as far as when the school found out and when cleaning began and that kind of thing?
As I mentioned before, we have had enhanced cleaning procedures for the last week. I can tell you that we got notification late last night that a student of ours might have been the person that tested positive. So this morning we engaged in a series of conference calls and confirmed that, and we started the cleaning approximately 2 o'clock today.
But then it's going to go on again tonight? Did I understand that correctly?
So we had cleaned on Friday night, and we cleaned again starting at 2 o'clock today, taking place as we speak.
And the buses were being cleaned?
Every day, yes.
And the group outside the middle school, there was a large group of people. Was that the cleaning crew?
I have not been by the middle school today. I can tell you that our facilities are used on a daily basis throughout the day, so I can't confirm if that's what that group was or not.
Just another question for the doctor. Have you guys been able to estimate, and I know that's probably a really tricky thing, but estimate like how many, if you don't want people to get tested necessarily, but you're also very aware that this is just out there in the community. Is there any kind of estimate on how many people in the county like might have it, or I don't know if you can speak to that?
Yeah, I'm sorry, I don't have any estimates for how many people in the county could have that. Unfortunately, our main tool for knowing would be the test. And I explained to you some of the reasons why testing might not be appropriate for some individuals. And the advice to stay home when sick and recover at home really does have a significant effect on decreasing or limiting the spread of the infection in our communities.
When you say that, a lot of people are like, I don't have sick time, I feel pressure to go to work. I guess just reiterate, because I even have friends that I know have colds and they're still out doing their normal daily routine.
Yes. I think this is, you mentioned that, to repeat the question, that people are out and doing their usual routine when they have infections, and that could be because they have some barriers or limitations to be able to take sick time off. We recognize that that is absolutely a concern, and we have been trying to message to employers and people in authority to really understand the importance of allowing people to stay home or work from home to decrease the spread of infections in our community. Those policies would be a huge help to helping limit the spread of the infection. I agree with you.
Mike, what's your response been from parents? I know you guys get Facebook messages and emails. What are people saying?
The communication is only a couple hours old at this point, so I can tell you that the people are concerned. I think this entire event for the last several weeks throughout the nation and throughout the world has caused increased concern, and I would say we're seeing that concern as well. We will continue to communicate and get the best information out that we have, encourage people to allow their students to come to school. We believe it's a safe and clean environment, but I can tell you that they are concerned.
Is there anything that you can say, I mean, I know this has been around and going on for a long time, and adults are scared, so is there anything different being said to children about this now going forward?
So one of the things that we have been doing is having those ongoing conversations with our students. In addition to reinforcing personal hygiene habits that are going to be helpful in containing the spread of this virus, we've also been talking to students about how it's spread, and so those conversations have been ongoing. I would anticipate tomorrow in classrooms there will be further conversations around how students are feeling about this. I can anticipate teachers doing a nice job with allaying their fears. It will be a continuation of the conversation that's been going on for the last week or so.
Remind me, do we know how long it lives on surfaces? Was that ever narrowed down? Because I know initially we weren't sure as far as just for like cleaning and stuff like that.
So I think we are in a time where we're constantly learning about this virus, so I don't have anything definitive for you for how long it can survive on surfaces. With other viruses, it depends on a lot of things. It depends on whether it's a solid surface or whether it's a wet surface or not. So our general recommendations are to disinfect all frequently touched surfaces as a precaution.
Can you remind me how you guys go through the testing process? Is it, I'm just trying to think, like you guys recommend people to specific facilities, or do you guys administer tests yourself, or how does that work?
Yeah, so if a patient needs to be tested, that is arranged through their healthcare provider. For the testing that needs to be done for COVID-19, healthcare providers do need to take additional precautions and wear safety gear such as masks and face shields just to prevent them getting the illness. Sometimes there are special rooms used to control the airflow. So some health systems have been preferring to test patients in places that have that special gear and those special facilities, which tend to be hospitals or in emergency departments.
So with this like specific person, you recommend, is it a recommendation that somebody get tested, or does the county mandate that at some point, or how does that exactly work with perhaps this person who has tested positive and now you're trying to like see if other people in close contact have also had it? How does that work? Is it just like a voluntary thing, or?
So yes, testing is always voluntary. And in some instances, providers will so the testing process has been fluid. Right now, a provider, if they have a patient who's severely ill, can submit the tests if they meet certain criteria of the illness, and those will get run by the state lab. There are also some exceptions made for public health investigations so that people do not have to meet the criteria of being severely ill in order for those tests to be prioritized and run. And the purpose of prioritizing those is to help with public health investigations to understand the spread of the illness.
Is that what happened in this case? Because typically they're saying if you have mild symptoms, just stay at home. We're not going to test if you're not in that high-risk group or you have traveled, and this is not an instance of travel. So why was this student tested?
Yeah, I can't go into the details about that. I just can give you an overview of the different pathways that people can get tested and have a diagnosis of the illness.
The information regarding, the details and the group of, I think there's 5 here in Washington County, you're not speaking towards how they may be related to one another?
No, we do not share those details of a public
Is
health
that your
investigation.
policy in Washington County, or is it state policy? Where's that policy coming from?
So that has always been a privacy policy of public health investigations. It's not alone for Washington County.
Do you think it would help to share that, though, so more people can just be aware that, hey, maybe I did come in contact with somebody, or how are those folks notified? I mean, because if we're all, out and you don't know who you've come into contact with, and...
Yeah, so with public health investigations, we do notify people that have had close prolonged contact. But you're right, that has limitations. There can be other interactions that public health may not be aware of. And that could be very well some of the, sorry, let me restart that sentence. And with some of the community spread that we've seen, there have not been any identified linkages. So I think something for us to understand is that this is out there in the community. People can encounter it independent of any known links. And so we need to be vigilant about any symptoms that we have and stay home when we're sick and seek care if we need it.
Do you think it's fair to say that many more people have it in Washington County than these handful of people that have tested positive? Is that a fair assumption at this point?
I don't know that we can say that with the information that we have. In the past few days, we have seen some identified cases in other counties as well, and there are no known links to other cases. So I think right now it's hard to say just how prevalent it is out there, but we know that we have it in our community because of those cases.
So school is normal tomorrow, parents should show
Based on the guidance we received, we are confident that we are offering a safe environment for our students, and we encourage all of our students to come to school tomorrow. Yes. Thanks, everybody, for coming.